Welcome to the Nelson Mandela School of Public Governance. It's such a pleasure to see all of you here today. It's my pleasure really to invite an excellent group of panelists who will be led today by Kiltha Sai to this Roundtable series. I want to first introduce myself and the Mandela School. My name is Faisal Ismail. I am a professor and director of the Nelson Mandela School of Public Governance here at the University of Cape Town. And the school, as you know, is based at the university, but it is an African school which has the scope to work across the continent, building networks of academics, scholars, policymakers, NGOs, and all other stakeholders who are interested in the challenges faced by the African continent. The school launched in 2020 a series on a webinar series on the African continental free trade area and transformative industrialization. In this context, we focused on one of the most pressing issues which faced us in 2020 and continues to, the COVID-19 pandemic. And we decided to launch a program on vaccines, pharmaceuticals, healthcare technologies, and transformative industrialization. COVID-19 exposed the asymmetries and the inequalities of our world and our societies. And you will recall that in Geneva, our colleagues from South Africa and India launched a campaign in 2020 to try and get more flexibility in the existing global rules on intellectual property, which tend to lock up the knowledge and the technology in patent rights of the big pharmaceutical companies, raising prices and making vital medicines such as vaccines inaccessible and unaffordable to the majority of poor people in the world. And so the campaign for a waiver from intellectual property rights was launched, with over 100 developing countries in Geneva supporting that call, pointing to the inequity in the existing rules on intellectual property. That campaign has continued in Geneva and around the world, and pointing to the need for global solutions for health problems. Secondly, we have seen how over the last 2 years, the rollout of vaccines which were created by some of the leading economies has been inequitable, with the bulk of the vaccines going to the north, to developed countries. Many of them were able to vaccinate their populations and provide them with boosters, whilst in many of the developing countries, especially in Africa, we have still to vaccinate the majority of the population. This inequity, the Secretary General of the United Nations called vaccine apartheid. And thirdly, one of the most starkest inequities that we have witnessed on the continent is the stark inequality in vaccine and pharmaceutical production. Africa produces just about 1% of its total vaccine consumption. So 99% of vaccines are imported from the rest of the world. And a similar pattern we see in the pharmaceutical sector as a whole, pharmaceutical technologies, with Africa being a major consumer and unable to produce its own. And it is for this reason that we launched this program of research, public dialogue and engagement on how Africa can increase the production of vaccines and pharmaceuticals and technologies and health technologies on the African continent. I'm very pleased that we have witnessed on the continent a great deal of positive energy, with African leaders working together, and the African CDC, the Center for Disease Control, led by Dr. John Nkenga Song, providing amazing leadership at a time of crisis, bringing together African countries to procure PPEs and vaccines together, to negotiate and apply pressure on big pharma and northern countries to support Africa during this crisis. The African CDC also launched a research program on how to increase manufacturing in Africa, and I'm very pleased that Kiltha Sai is a member of that task force. We have also seen this pressure resulting in a lot of activity by investors looking at the continent for the first time a lot more seriously, beginning to build partnerships. One of the most exciting here in South Africa with Aspen, but many others on the African continent. We've yet to see how those can take root, and that will be the subject of the discussion today, how we can stimulate partnerships so that production begins to move to the African continent. So the Mandela School is very excited about this second webinar and a roundtable series, which is being led by our stream leader, Kiltha Sai. And those of you who don't know her, she looks young, but she has a lot of experience. She's worked for over 20 years in the pharmaceutical industry. She's worked for Johnson & Johnson on the African continent, traveled across many countries. She has served in a senior position of leadership in Johnson & Johnson, and also provided leadership for many industry associations and working groups, facilitated several task forces. She's a pharmacist by training. She also has several other degrees, and she is now concluding her PhD research with Utrecht University. We hope that she would be here with the Mandela School, but I'm sure she will continue with her postdoc work in association with the Mandela School as she goes forward. We're very pleased to have her in the Mandela School, and we're very excited about this research program because it is very relevant to the current challenges we face. When we met last with a group of scholars, policymakers, and private sector entrepreneurs to discuss this question of pharmaceutical manufacturing, we got a lot of excitement with people like Dr. Adewale Aguali, who is a policymaker in Ethiopia and has led a process to try and build industrial manufacturing of pharmaceuticals in Nigeria, and has had some success. We've looked at some of the lessons of that for other countries on the African continent, and that research program is one which we want to continue to explore in the discussions today. So I really am thankful to all those of you who put this program together in the background. And I'd like to hand over to Kiltha Sai to facilitate this roundtable discussion today, and to also introduce you to the amazing set of speakers and experts that we have for the roundtable today. So over to you, Kiltha.
Thank you, Faisal. Thank you very much for that kind introduction. And yes, this is the beginning of a new journey where we're going to be looking at the pharmaceutical and healthcare value chain. Today, we're focusing in on vaccines and vaccine manufacturing because it's so topical at the moment. And I think that you will agree that during 2021, our calendars were filled with webinars and conferences on issues related to vaccine equity and vaccine manufacturing. And some of us, you will agree, are probably suffering from a little bit of vaccine fatigue with all of these policy conversations that we were having in 2021. However, even though there was broad agreement on, in most of these conversations, that African countries should be focusing on local manufacturing, a lot of these conversations stopped there at this policy consensus. And we really didn't get down into the detail of what is it going to take to create this manufacturing capacity at a practical level, and how are we going to sustain this manufacturing capacity. So many of you who have been in the pharmaceutical sector for a long time will know that we've had similar discussions with regards to industrial policy and local manufacturing capabilities when we look at antiretrovirals and local manufacturing capacity. Yet when we look at the pharmaceutical sector today, we are still largely import dependent. So 70 to 90% of pharmaceuticals are still being imported. So we have to ask ourselves, what are we doing wrong? Where are we going wrong in terms of creating this sustainable local manufacturing capacity? And what is new in our environment that we can take advantage of today that wasn't there before? And the big new thing is the African Continental Free Trade Agreement. So yes, we have had industrial policy before with a focus on local pharmaceutical manufacturing, but we've had very much national focus and national policy frameworks. We've also had the Pharmaceutical Manufacturing Plan for Africa, which has been around for a long time. And one of our speakers, Dr. Paul Lartey, has been intimately involved in that policy previously. So these are the kinds of questions that we are going to be looking at today. We also tend to forget about non-manufacturing countries on the African continent and how they could potentially contribute into the value chain. So we look at pharmaceutical manufacturing or vaccine manufacturing, but we also need to look at where do those production inputs come from? Where does the equipment come from? What services are required to keep that production line running? So if we just look at 2020 and 2021, when the world was rushing to get vaccines to people, we also suffered a lot of vaccine stockouts in South Africa. And we had little understanding on why those stockouts happened. What went wrong in those production processes? So what do we need to have in place to keep those production lines running? And how do we understand those production processes? So these are the questions that our panelists are going to help us answer, because they are intimately involved and have been running their own manufacturing facilities for many, many years. So what differentiates our conversations today from many of the conversations that you may have been involved in previously is we're really going to get into the practical details of what it is that we're going to need to be looking at going forward to create the sustainability of manufacturing. And when we had the briefing with the panelists, they were quite excited about this conversation because all of them, like me, believe that these are necessary discussions that we need to be having. And these are conversations that, unfortunately, we have not had in some of the other webinars and conferences. At this point, I'd like to introduce the panel to all of you so that you can understand why we are so excited about having them here, because they really bring a wealth of practical experience in this area. So starting with our first speaker, Dr. Chidi Inwaneka. He has an MSc in epidemiology, also a PhD and an MBA. He's a global health and strategic management expert with extensive experience in vaccine advocacy. He is also the chair of the Advocacy Working Group for African Vaccines Manufacturing Initiative, as well as the member of the board of the AVMI. He was also a member of the Market Design and Demand Intelligence Workstream of the Africa CDC's PAVM initiative, which looked at African Vaccine Manufacturing Initiative, and is also a member of the Global Fund Technical Review panel. He has held several senior management positions, including head of strategy and planning for the National Agency for Control of AIDS in Nigeria, and is the Deputy Director for Public Health Programs and Policy for the U.S. Department of Defense. He presently heads the programs for the Adventist Development and Relief Agency in Madagascar. He also served on boards of several national and international organizations, including boards of Adventist Health Services in Nigeria and Relief Agency in the Gambia. Then secondly, we have Dr. Paul Lartey. He is a pharmaceutical industry best practice advisor at the National Coordination Center and senior consultant for pharmaceutical R&D BioBridges in the US. He worked for decades as a drug discovery scientist and was director of infectious diseases drug discovery research at Abbott Pharmacia and Upjohn and at Pfizer. He founded Lagray in the US, focused on pharmaceutical sector development in Africa, and established Lagray Chemical Company in Ghana. Lagray was the first fully vertically integrated pharmaceutical company in West Africa and was the first to develop and manufacture APIs in West Africa. He was also the founding chair of the Federation for African Pharmaceutical Manufacturers Associations, and in that capacity he was directly involved in the development of the pharmaceutical manufacturing plan. He was also on the steering committee of the AMRH, which is the Regulatory Harmonization Initiative, looking at regulatory harmonization for the registration of medicine. Then we have Dr. Simon Aguali. He is the CEO of Innovative Biotech, Nigeria, and Innovative Biotech USA. He is a member of the board of the AVMI, which is the African Vaccine Manufacturers Initiative. And in 2019, he was asked to lead the COVID-19 vaccine task team. He is also an advisor to WAHO, which is the West African Health Organization, and part of a recently established ECOWAS vaccine task force. He's also currently the lead of technology and IP for the PAVM. Dr. Aguali has a vision for the development and investigation of HIV vaccine constructs from prevalent Nigerian strains which are relevant to Nigerians. He's currently developing a novel vaccine against COVID-19, Ebola, cervical cancer, and HIV, using innovative viral-like particles. He is also setting up his own manufacturing facility in Nigeria to serve the African community. He was a postdoc fellow at the Institute of Human Virology, Baltimore, USA, and a visiting scientist at various institutions in Brazil, Germany, and the UK, and including the US. Then lastly, we have Mr. Rajinder Sethi. He is the CEO of DCVMN, which is the Developing Country Vaccine Manufacturing Network. He is responsible for leadership, governance, strategic orientation, and operational excellence of this network. To meet unprecedented challenge posed by COVID-19, Rajinder works shoulder to shoulder with the industry associations like AfCFTA and BIO, along with COVAX partners. He is a member of several advisory expert groups, including COVAX manufacturing and supply chain task force leadership teams, M14A, market information for access to vaccines, advisory group to WHO on malaria, global TB vaccines R&D roadmap, expert group on seasonal influenza vaccine and market design and demand intelligence of the PAVM. He brings over 43 years of experience and deep insights of the industry, including pharmaceuticals and biological products, as well as organizational development in India and international markets, and invested over 24 years at top management level, including 4 years on the board of directors of Sanofi and other remaining in pharma. He is a member of the Gavi Program and Policy Committee, as well as the Vice President of the DCVMN. So I'm sure you'll agree that we have a very, very experienced panel. I'm certainly looking forward to hearing the insights, and I hope that you will too.